So now our next speaker, Dr. Arvind Nanjundappa, will talk about how AI is used to predict and reduce risk of myocardial infarction in India.
I would like to thank the team of Intel from India, mainly Ms. Nivruti Roy, Ananta, and Konal for this wonderful opportunity to present at the INI conference. We are working with Duke University in conjunction with Professor David Hoffman, and Ms. Kathleen Beben is one of the students who is helping us with the project, where we are figuring out the artificial intelligence to predict and reduce the risk of myocardial infarction in India. The background for this is India is the second largest population globally, with more than 1.38 billion people of diverse groups. Over the last 3 decades, India has had a rapid rise in economic growth, and its country GDP now rests among the top 10 countries in the world. The rapid rise in population and economy has led to increased inactivity, obesity, hypertension, type 2 diabetes mellitus, and cardiovascular disease. Cardiovascular mortality is now the leading cause of death in India. The statistics to back our project is the estimates of global burden of disease shows 24% of all deaths in India are due to cardiovascular disease. Premature myocardial infarction in young patients less than age 40 years can cause death, disability in their prime of life, and have a consequence in the patient's life, family, healthcare system, causing an increased strain on the economy. The InterHeart study have identified 9 modalities of modifiable risk factors, such as smoking, hypertension, diabetes mellitus, waist to hip ratio, dietary patterns, physical inactivity, alcohol consumption, plasma apolipoproteins, and some psychosocial factors that account for majority of risk factors in cases of myocardial infarction. The reasons why myocardial infarction cases and fatalities continue to rise in India are poor patient understanding of symptoms, delays in seeking care, improper triage at hospitals, delayed and variable interpretation of results, inadequate treatment, poor compliance of the patient to treatment and follow-up. Can AI assist patients and physicians in the early detection and management of myocardial infarction? We seek to create an AI-based intervention in the form of mobile app that will accurately inform patients of the necessity to seek an early care and predict the best course of care during the hospitalization. For example, a young patient with chest pain could input his symptoms into the app, which could then direct him to a hospital visit. At the hospital, an AI-based algorithm can help in risk scoring and stratification to predict the risk of myocardial infarction. The AI-based intervention that is proactive and predictive of outcomes can help to improve the compliance to medical interventions such as medications, catheterization, or a surgical procedure. The application of artificial intelligence always has a constant relation and a play between the machine learning and deep learning, and we are planning to adapt these techniques in diagnosing and treatment of myocardial infarction. Artificial intelligence with the self-learning algorithm using an app can improve machine learning process, wherein artificial neural networks such as EKG or a convolutional neural network such as an echocardiogram, along with the biomarkers, will play an important role, which in combination with deep learning can help in application of the computers to predict a model with a precision medicine delivery, and also advanced imaging interpretation such as cardiac catheterization or a CT angiogram. The definitions were basic. However, I'll just touch by artificial intelligence, as we know, is the intelligence demonstrated by the machines as opposed to natural intelligence by humans. Machine learning is the study of computer algorithms that can improve through experience and repeated learning process. Supervised learning requires humans to label the input data, and unsupervised learning finds patterns in a stream of input. The natural learning process allows machines to understand and read human language. So how do we utilize this machine learning? If you take the raw data of patient symptoms and EKG with an unsupervised machine learning, it would be helpful to find patterns such as symptoms, say chest pain, along with other symptoms such as shortness of breath, abdominal discomfort. When you process the data, when you combine with the patient's age, patient's characteristics, the data output can be a model-trained symptom recognition, such as chest pain that can lead to a myocardial infarction. In terms of a supervised learning, here there are preset algorithms to identify shapes of the EKG and the pattern, and a computer model trained for data output can look at a predetermined EKG and recognize myocardial infarction accurately and rapidly. So machine learning to identify the symptoms and predictive of myocardial infarction, this can be done in several ways. One of the easiest ways is the data can be classified as plus or minus for myocardial infarction, mainly as positive or negative. The predictive outcomes can have labels such as positive or negative labels based on indicative of symptoms as chest pain or no chest pain, and classified further with biomarkers such as troponin. Some of the weighted algorithms can include both the symptoms and biochemical markers. The classification can be linear. For example, in a young male patient with a crushing chest pain and a positive biomarker should identify an impending myocardial infarction. A visual representation in the emergency room or during the evaluation, such as a facial grimace, clenched fist over the chest, and doubling over, can trigger a high index of suspicion for myocardial infarction. Non-specific symptoms can be eliminated based on the historical outcomes, such as in a young obese teenager, a chest pain is usually referred to as heartburn, indicative of gastritis rather than a myocardial infarction. So the application of artificial intelligence in image interpretation, mainly the EKG and echo, what are the advantages? It's very accurate, cost-effective, and rapid interpretation. There is less error than human interpretation, can rapidly triage patients in emergency room to alert a cardiologist and activate catheterization laboratory in a timely manner. Low complication from appropriate medications such as a blood thinner can be life-saving for the patients. Here is an example of artificial intelligence to predict urgent procedures for myocardial infarction based on EKG interpretation. This was a study published by Goto and his colleagues, wherein computer-based algorithms was used comparing from the past data to the present, and using bidirectional methods, they were able to create neural networks where image interpretation was very accurate, had very few errors, and urgent revascularization was performed. This was exceeding what a human error would have occurred and what the estimates of revascularization just based on the human interpretation of an EKG. Further AI applications in myocardial infarction, AI can help with remote wireless monitoring of patients after heart attack at their homes. Advanced monitoring can show breathing patterns such as sleep, heart rate variability that can affect the stability of patients. Patient behavioral patterns can document exercise, mobility at home, and medication compliance. Remote monitoring of patient gait speed, how often they are walking, how often they are able to sleep, how long they are able to sleep, can predict the frailty. a key indicator of a procedural outcome and readmissions after a cardiac procedure. AI can further assess patients beyond a traditional cardiologist can do. Emotional issues such as depression and anxiety are very common after a heart attack that cardiologists neglect, and remote monitoring can assess these behavioral patterns. Patient sleeping pattern during a 24-hour monitoring can show signs of heart failure. For example, if patient sleeps in an easy chair rather than a bed, an early sign of heart failure, such as erect posture, pushes the blood to the legs and avoids chest congestion. So that may be the reason why patients prefers to sleep on a chair rather than on a bed. Increasing sleep or insomnia, both ways can be signs of fatigue and worsening of the heart function. The effect of medication such as water pill can be assessed with remote monitoring. There will be increased frequency to the restroom and increased mobility due to less congestion. Remote wireless monitoring can also assist in patient safety, such as fall that can trigger an emergency medical service, prevent hospitalization. Patient behavior can alert doctors to intervene early. Monitoring patients by nursing for medication delivery, care, and also can avoid patient abuse by healthcare personnel. What are the pitfalls of artificial intelligence to predict myocardial infarction in India? The obstacles are over-enthusiasm, both methodical and relative to implement, can cause societal fear that machines will take over. The challenges involve all healthcare stakeholders, such as patients, families, hospital administration, peer physicians, nursing personnel, and healthcare insurance policymakers. The stakeholders, especially physicians who have learned from textbooks, may trust the output from machine learning. The results must be interpretable and must contain valid explanation and reproducibility. The main burden in an accurate diagnosis of myocardial infarction without any inherent bias, we need to consider the fear of misdiagnosis due to vague patient symptoms, memory issues, language barrier, and accurate interpretation by machines. In conclusion, artificial intelligence is the future technology that has an immense potential in cardiovascular healthcare globally. Artificial intelligence will be a valuable tool for rapid diagnosis and treatment strategies to treat myocardial infarction in India. AI-based applications should be adapted carefully in real-time diagnosis and treatment beyond clinical studies and publications. A sound clinical judgment, context, and rationale will be of paramount importance in the interpretation of studies using artificial intelligence. Thank you for giving me this time and opportunity to present, and we hope to work with large hospital healthcare systems to implement AI to diagnose and treat myocardial infarction.
Thank you, Dr. Arvinda, for the talk.